407-422. That's 407-422-1212 or text 23680.
Is it that time? It is. There it is. Welcome, Stages of Life Radio. Melissa Fox helping out Dr. David Klein as always. We are live until 5 right here on News Radio WFLA Orlando. Text us in your questions at 23680 or get on the phone 407-422-1212. Today we're going to start off things talking about cryptogenic pain. Did I say that right?
That's very good. Nicely done. Nicely done indeed. Cryptogenic. So what does this mean?
What's it mean?
Cryptogenic. So it means of uncertain origin. So where'd it come from? Why is it there? What is it exactly? You know, one of these kinds of interesting things where people walk around with, these pieces of paper that say, I have a herniated disc. I have this x-ray that proves that I have a problem. And this is what the problem is. And unfortunately, it doesn't usually work out that way. And were it true that that piece of paper would necessarily tell you what's wrong, then the intervention that's thrown in front of you, that which is proposed,
Right.
would fix the problem. But the reality is that it isn't so. And that's what we're going to get into today. Why is this important? And the answer is very simple. It's because if we can't figure out really what's causing a symptom, you don't have a prayer to fix it. So my wife Tess and I were watching this, it's like a series out of New York. The New York Times magazine, it's called Diagnosis. And they have this gal up there who's very smart. Okay, she does a good job at trying to present a problem that she can't figure out. And then she goes to the World Wide Web to get all kinds of ideas as to what might be causing it. And what's, because more than one mind might be helpful. And while that's often true, most of the things that get thrown at you are exactly wrong. And that's kind of what happens with lab work, and that's kind of what happens with radiology. And in fact, that's what happens with life in general. You have a problem. You have a symptom. What's causing it? Somebody gives you a diagnosis. And because they have an MD, DO, DC, or PRN, degree after their name, prorated not to use as necessary, then it's got to be true. And the fact of the matter is they're usually wrong. So I've been a doctor for a long time. I've been in private practice for 42 years. And the most common diagnosis of all that comes to me is misdiagnosis. Now that is an audacious thing to say, but it's exactly true. It's exactly true. Why are they there? The answer is very simple. Because by the time they get to me, everybody's already pretty well screwed them up or couldn't possibly figure it out. And it's because they got away from the basics. So we were watching two episodes last night, and they were both quantums, just goof-ups, to the point where I'm not going to watch the thing again. The premise was marvelous, but as it turns out, it was absolutely just dumb. Well, what is the problem? And the problem is this. If you can't figure out what's wrong, you can't fix it.
Right.
And asking a room full of people, a bunch of opinions, these are people that have nothing better to do than to be sitting on the computer, you're not likely to figure it out either. More so is that none of them have all of the data, have a finger on the patient, or have actually seen the patient in person. So the likelihood of any one of those people figuring it out is insanely small. And then it becomes this gal's purpose in life to sort through hundreds, if not thousands, of potential problems as if she couldn't do that by doing a simple differential diagnosis.
Wow.
So if you don't know what something is, you can't correct it. Now here's problem number 2. Radiology doesn't tell you what's wrong. So you can have an x-ray, you can have a mammogram, you can have an MRI, you can have an ultrasound, you can have a colonoscopy. It doesn't necessarily tell you what's wrong. It tells you what might be there. What does this really mean? What it really means is that it doesn't tell you causality. And this is something that we all know in medicine and we promptly forget after the exam.
Really?
Just because you have an x-ray that says that you have something on the x-ray doesn't mean that that's causing your problem. Case in fact. Well, you look at the x-ray and it tells you, well, you have a small bone spur here. Doesn't necessarily tell you that's what's causing the pain. You can have a big old abscess sitting in your spine, not see it on the MRI, and that can cause you all manners of problems, as can cancers if they're too small. But how many people over the age of 25 that have been at all active in their life don't have at least bone spurs on their spine, which are asymptomatic? So case in point, you go to the mall, any mall, doesn't matter what mall. You look at the people wandering around and you take 100 of them at random. 1/3 of those people are going to have a herniated disc on their MRI and be asymptomatic. Now, God help that person if they pull a muscle. God help that person if they get a tendinitis in the wrong spot. They'll get an MRI, and sure enough, that must be what's causing the problem. Correct? Thereby, 1/3 of all people that get operated on for back pain get worse. 1/3 stay the same, and 1/3 get some better. If those odds sound good to you, I suspect that you're probably not listening to its entirety. So what happens? Where do you go? Who do you see? So most people, well, I'm going to go to see an orthopedic surgeon. Orthopedic is good. The surgeon part is questionable, all right? So when I started off in general surgery, don't let skin stand between you and a diagnosis. It was one of the things we were told. Nothing better than a Bard Parker, that's the name of the company that makes the scalpels, diagnosis. So there are a lot of these sorts of things. But if you understand, dogs bark, surgeons operate. So they're going to look for excuses to operate. So there are lots and lots of people that get operated on really unnecessarily or incompletely or incompetently in some cases. Meaning well, they end up getting hurt. So when I was at Duke, where I did my training, we did not operate on backs, that means necks as well, for pain alone because it doesn't fix the pain. So we're going to be talking about knee pain and hip pain. So why am I starting off looking at backs? Because most people can identify with that. So what are we complicating the matter here? So what's complicating the diagnosis and procedure? And then there are economic pressures. If you don't operate on people, you don't get paid. Well, that's kind of cool. Well, wouldn't you know it? We used to get paid more for doing surgery than we do now. So you have to do more of them. Because these people still have to do what they have to do. So you have economic pressures. We're going to be doing procedures instead of doing what you could do. If somebody injures their back, herniated disc or not, if you put them at rest for 6 to 8 weeks, that doesn't mean bed rest necessarily. Most get better. Most parts of the world, they do not operate on backs, necks like we do here. And they get every bit as better as ours do. In fact, they probably get a lot better, faster. So narrow training ends up with narrow vision, and that's the main issue here. If what you're used to doing, what you know to do, and what you plan to do, and what you like to do, and what you get paid to do is surgery, you are going to do it. So what we're going to do in the next little segment, okay, we're going to start looking very specifically at knee pain, and we're going to look at some hip pain. Now, why am I going to use those two together? And the answer is going to become obvious in just a moment or two.
Makes sense.
It does, and it's going to make even more sense momentarily. So I did start off as a surgeon. I didn't run that route. Actually, I started off as a family doc, went into anesthesia surgery, and then back into family practice. Wouldn't you know? I like it better.
You like that? It was better than a gong
That's
segment.
that's okay. The last time we did this, I knocked over a glass of water.
Yeah, that was
It
fun.
ruined some valuable electronic piece of equipment.
Ooh, yep. So we'll be paying for that for a while.
Yeah.
That's a joke, actually, and it's my home studio, so no worries. I know, right? Oh, they're going to be getting you. No. We're going to take a quick break. We'll be right back. Follow Stages of Life Medical Institute on the social media, YouTube, Facebook. We're broadcasting live there as well as on the radio, so you can get a peek-see at the doc and me. We'll be right back at Stages of Life Radio on News Radio WFLA Orlando. Tanya's watching us
Cool.
on Facebook. She says, I've had scans throughout my life that found liver cysts. Doctor says, don't worry about them. Would milk thistle help this issue? I'm 69.
Okay, well, you've made it this long without having to do anything about it. My guess is unless somebody shoots you or runs you over with a tractor, you're going to continue to do well.
Yeah.
The cysts on the liver are typically caused by something called histoplasmosis, which is it's a fungal spore. You inhale them, they end up going through the bloodstream. You'll end up with these little cysts in the lungs, liver, and kidneys. They sit there and you leave them alone. That's the most likely possibility, much more common in the mid-Atlantic states, central United States, and also in Arizona, out that way. There it's called valley rheumatism. So more than likely that's what you're looking at there, and the advice was good. Just leave it alone. Don't pay any attention to it. Milk thistle, you're a girl. It will further lower your estrogen. Okay, so you're 69 years old. Your estrogen is low anyway, and if you really want to turn it to zero, that's a really bad choice. So no, I wouldn't do it. If you really feel the need to do something for your liver, take L-theanine, that's Theanine. The dosage is 200 milligrams at bedtime, and N-acetylcysteine, 500 milligrams 3 to 4 times a day. Brilliant liver cleanse, does great for it, but doesn't lower estrogen.
No?
No.
Yeah, I've heard of it, but honestly...
Milk thistle, it's great for guys. Now, there's a time and a place for this. If somebody comes in with excess estrogen, I will use silymarin, milk thistle. Mm-hmm. If somebody comes in with hepatitis or they've got, Tylenol toxicity, I'll use milk thistle and N-acetylcysteine and then worry about the estrogen later.
Karen is saying that the knee pain and hip pain comes from extra weight as well, correct?
It most certainly can. In fact, the weight can make it worse.
Yeah.
So, again, one of the things that we were taught, when I did a very good surgical residency, was that you didn't do joint replacements in people that were grossly overweight.
Welcome back, Stages of Life Radio, live and in person, Sundays at 4 o'clock, all over the internet, too. iHeartRadio, you can listen to us anywhere. Check out the app and check out the podcast. Just go to stagesoflifemedicalinstitute.com, and there's a whole directory there of wonderful things you can find. stagesoflifevitamins.com, Stages of Life Radio. We're on Facebook and YouTube. We also take questions during the commercial breaks on the radio on the internet side, so there's
there's more to be heard.
There's just more doc all the time. So, Dr. Klein, you were talking very much about knee pain and hip pain and how the hip bone's connected to the knee bone.
Well, sure. Okay, so why do I want to do this? Because for whatever reason, okay, and these sorts of things happen in my life, and they probably happen in yours, is I had a run on knee pain this week. Okay, now that doesn't typically happen. It might be a run on, one problem or another. It could be eye pain, ear pain, thumb pain, but this past week it was knee pain. Don't know why. Now, it's not like we had a tennis tournament in town. It's not like any of those sorts of things.
I had knee pain too.
It's very interesting. Why knee pain? So the first thing that I like to do when somebody comes in with knee pain, and they all come in and tell me the same thing. Well, I went to the doctor and they did an x-ray and it was bone on bone. Therefore, it must be causing the problem. So really? Now, the bone on bone is because it's a wear part and you're fat. Okay, so what's happened here is your knee has worn out. The cartilage is gone. But bone on bone doesn't necessarily hurt. Why not? You would think it would have to, because bone on bone sounds like a really terrible problem. But if it were bone on bone causing the pain, then why do you have episodes and periods of time where it doesn't hurt at all? And other times it hurts like the dickens. So do you think the bone grew back and then disappeared all of a sudden?
No.
What was the difference? So the way I like to think about this is that the pain or the location of the pain is more like an echo. Don't confuse the echo with the voice. If an echo comes bouncing back at you from the back of a cave, you know that you're the one that delivered the first shout. It's coming back at you. Where did it come from? It fools children, but it shouldn't fool you. With knees, bone on bone, the sensory nerves that innervate the bone itself and the cartilage are in a membrane that actually gets worn away with wear. So the pain isn't actually coming from the bone itself. Bone is not all that sensitive to pain, but the periosteum, the membrane around it is. So if it wears away to the point where you just got, raw bone on raw bone, and rarely does it really look like that when you open it up, that would be something that would hurt all of the time. You wouldn't be able to move the joint very well at all. But you have other tissues. So don't confuse the echo with the voice. So what can cause knee pain? Mm-hmm. Now, if you're a pediatrician and you're listening in, you're going to think, well, in children, it could also be coming from the hip. Well, you know something? Good for you. Kids get older and the same thing happens. People can have knee pain from things that are going on in the hip. Hip and knee and hip goes backwards and forwards. It's part of the echo that I'm trying to teach you about. So you can't look at just a knee and think, oh my, this is really what it's all about. And you have to look at the patient, look at their history. So I had a patient in, very, very interesting, who had terrible knee pain, all right? And they looked at it and said, well, the problem here is you have bone on bone. Okay, great, but we really can't operate on it because you've had this open heart surgery where they stripped off a vein from your lower leg, replumbed the heart, so you're really not a good surgical risk. And looking at the patient's walking, okay, which makes, to me, says that they are a very good surgical risk, but the risk is having the surgery, right? Okay, they may not need it. So one of these individuals, very, very interesting. Do you know what they have to do, okay, to strip these veins back? What do they do the first time that they went ahead and they did the scoping of the knee? Scoping of the knee is interesting. So they put a tourniquet around your thigh, big tourniquet. It's got 2 ports to it, and they inflate these things to over 400. Now, do you remember having your blood pressure taken? How comfortable it gets when it gets to about 180?
No.
I want you to imagine somebody grabbing your thigh and cranking that puppy up to twice the pressure. Now you're knocked out.
No.
Okay, you're out. But the pressure on the nerve tissue underneath it can cause pain following up. And the same thing happens when you do heart surgery. When you're stripping the saphenous vein, you do damage to the saphenous nerve. What these 2 things have in common is damage to the saphenous nerve. It's something called Hunter's Canal, which is just north of the knee. And it branches from the back, femoral nerve. It comes down, branches out. And so the femoral nerve causes pain in the anterior knee, anterior shin, and to the top of the foot. Wouldn't you know, it also kind of looks like a herniated disc. So you got that MRI? Well, we have a herniated disc also. So we're going to work on the back first, then we'll work on the knee. And by that point, if you're not already crippled, we'll start to find the problem. So in looking at pain problems, it's not enough to look at the scarring. It's not enough to look at the x-rays or MRIs or CAT scans or any of that kind of stuff because they are often misleading. So this individual had saphenous entrapment at something called Hunter's Canal, which is halfway up the thigh. So patient sitting in there, I say, well, tell me if this hurts. And you kind of gently grab them just north of the knee and they let out a hoot. Now you better do this off to one side or you will get kicked. Turn your head, turn your head and cough.
Yeah.
Oh, you're going to end up with edema where you don't want it at a time you don't need it. And so, but a kick in the groin is not something that makes me particularly happy. Sometimes I accept it from my wife, but I will not accept it from anybody else. So what's it all about? We apply something called keto GABA, which is a transdermal anti-inflammatory and anti-consultant, and 60 seconds later, the pain's gone.
Cool.
Okay, stand up, make it hurt. So the bone on bone is still there. Then why is the pain gone? The herniated disc is still there. Why is the pain gone?
Why?
Now, wouldn't that be embarrassing?
Inflammation.
Okay, no, it's gone because I just took out the nerve that's causing the pain.
Oh.
Yeah. So, the embarrassing thing would be having 2 other surgeries or the wrong surgery to do something that was a little more than a nerve compression. So we're going to be doing, another topic called nerve compression syndromes at a later date.
I'm going to deal with mine.
Well, that one right there is in ulnar entrapment. That's what's called the humor ulnar arcade, and we'll get into that at a later date. Okay, because
pointing at my funny bone.
Yeah, and there's nothing much to do with that. It's easy to fix. So don't forget the echo effect. So arthritis, inflammation of the joint, can cause pain. Bursitis, which is inflammation of a lubricating sac, and tendinitis, which is what happens. But you can also have entrapment. So one of my specialties in the previous life was unusual entrapment neuropathies. I used to lecture all over the world on this. Wow. What do I do now? Now I'm semi-retired, so I let everybody else goof it all up. I did a CD series on this, the DVD series. Okay, so there are multiple muscles that attach at the knee that can cause knee pain.
Okay.
So you need to know: do you have knee pain? Marvelous. Do you have hip or groin pain? Do you have foot pain? There's a series of muscles that attach behind the knee that go down to the bottom of the foot. So we have patients that come in with foot pain that have knee problems. We have patients that come in with knee pain that have hip problems with knee issues. And it goes back and forth and forth and back. So hip, what are the sorts of things that can happen there? So you've got somebody who weighs too much. They come in and they're told that I need to do a hip replacement. And people do. Well, why? Well, because they did this x-ray and it showed arthritis in my hip hurts, therefore that's where it's coming. That is a freshman failure. An x-ray doesn't tell you causality. In order for you to know causality, you have to unplug the problem and see if the pain gets better. So what are the common causes of hip pain? What are the sorts of things that are going to cause your hip pain? That's why you're listening. What's causing my hip pain? Well, let's look at the history. Does it hurt you when you're lying down in bed on that side? Okay, what do you think that might be?
You're betting.
Right. Okay. Well, does it bother you when you get in and out of the driver's side of your car or passenger side, getting in or getting out?
Could be the seat.
No, it could be your wallet,
Yeah.
as it turns out. But there are many things that will cause this depending upon what motion you're doing at any particular time. Or let's say that it only bothers you after you play a round of golf. Are you right-handed or left-handed? These are the sorts of things that'll help. So hip pain, most common cause of hip pain in my experience is something called trochanteric bursitis. Not necessarily greater trochanteric bursitis because there's a lesser trochanteric bursa, but bursitis in the lateral portion of the hip. And why does this happen? Because your bed is poorly suited to you. It's gotten too old, and now you're not rolling over properly, or the bed is too hard, or you're sitting around someplace where it's hard enough to cause this bursitis just given your weight. So you flop from side to side, side to side, back and forth, because what happens is you're supposed to be able to roll gently. However, if the pain causes you to spend more time on one side or the other, you're going to cause bursitis on the opposite side. In medical terms, we call that the contralateral side. So
Makes
bursitis
sense.
of the hip. Now, why more so in women than in men? Because in naval terms, nautical terms, women, their hip is the broadest part of the beam. Okay, that's where most of their weight lies. Well, no, your center of weight, your center of gravity is lower than that of a guy. A guy's center of gravity is about 4 inches north of that, closer to the waist. So when you're lying down in bed, 60% of your weight is going to focus right on that thing and be like an elbow. So if you were walking around on your elbows, you'd understand why you got bursitis of the elbow.
Aha. All right, we're just up to a break coming up here, and we got a pretty interesting call. I think you're gonna.
Excellent! It's a perfect time for a call too, actually.
Yeah, strange symptoms for 10 years. Can't sleep, seeing colors, headache, fatigue, no MS, MRI, head to the base of spine, nothing.
Okay,
no one can diagnose her, but the doctor's gonna learn.
Let's do this one on the air rather than during the break.
That's what we call a radio tease, Doc.
Oh, gotcha. Okay. I just got teased.
What? Easy now. We'll be right back. This is Stages of Life Radio. If you want to text in with your questions, the text line is 23680, or you can call 407-422-1212. You're listening to Stages of Life Radio on News Radio WFLA Orlando. Yeah, now we have some stuff on here. Tanya was asking if knee pain sometimes from how we walk or having bad shoes.
Yeah. Knee pain is one of these things that's experienced by lots of people. But the problem is that once you start operating on the knees, it starts this process that sometimes ends in misery. So I'm not a big fan of people operating on knees just to look around. Well, let's go ahead and push a scope in there and see what's happening.
Yeah.
Let's clean up your joint a little bit. Oh, good idea. When I used to watch these things being done when I was at Duke and when I was in private practice, we used to do a lot of these. And so they take this little shaver in there and they see all kinds of debris and start shaving away at the cartilage, which means you're working away at the cartilage even faster. The only time that really makes any sense is if you have a piece that's floating around. They may call it a joint mouse, a little tiny piece of cartilage that may be flipping this way or flipping that way. But for the most part, shoving, a 4 to 6 millimeter stainless steel trocar, boom, into your joint, and then rooting around a little bit does not sound like a grand idea to me. There are many better ways that you can actually deal with this. When we're going to come back, one of the things I'd like to talk about are what are your options other than surgery? What are your options other than medications? And believe it or not, they do exist.
Sure.
And they work.
Cool.
Does everything work for everybody? Of course not.
No.
But you know something? If you can forestall going in and doing a knee replacement or a hip replacement, you are way ahead of the game because they don't last forever. You go ahead and you put a joint replacement in there and you're one of those individuals where it gets infected, you can lose the leg. It's not a lot of fun. We have a personal friend that happened to. She didn't lose the leg. She damn near did, though. Thing got infected. They didn't want to operate on her to clean it up. Because if it gets done within 30 days, the hospital loses the money for the first surgery. Now, wouldn't you know? Now, is that kind of a cool factoid or what?
Wow.
So it's going to remain infected for at least 30 days, or the hospital loses the money for the first surgery, because that's what Medicare does. So if you don't know, if you don't think for a minute that there's a pecuniary reason for doing many of these things, you'd be sadly mistaken.
45 seconds. Coming back. Yeah. Do you want to take Jen then out of the break, and then we'll go back to this?
Run that one more time. What before the break?
Take the gal before we go after the break. I mean.
Well, after the break, we'll take her. Yes.
Okay. I just want to make sure she's there.
Yeah, because I've got some questions for her.
Yeah, I think it's about her sister. Though. I wish.
Well, she may not be able to answer the questions then.
I don't know. We'll see. Anyway, stand by, folks. If you're watching us on Facebook and Twitter and Twitch and Itchy and whatever the other
Itchy, Scratchy, and Twitch. Yes.
Good stuff.
Yeah, it sounds like menopause to me.
Something. Yeah. No, that would be.
Oh, yes.
Welcome back, Stages of Life Radio on News Radio WFLA Orlando. For more information on Dr. David Klein or to become a patient of his, stagesoflifemedicalinstitute.com. Very easy, right off of I-4, 434 in Longwood. So it's not out of reach for you if you live in Central Florida. We got Jen on the line. I was talking about her sister and such. Hey, Jen, you there?
Okay, we're going to go ahead and make a few minor adjustments on the sound equipment here so we can hear Jen.
Yeah.
I think we're getting closer now.
I have a home. We got her there.
Okay. This is the beauty in live radio.
Yeah, it is the beauty of live radio.
Unfortunately, as Melissa here is running back and forth playing with chords. Is she still on the line there?
I don't know. You still there, Jen? We may have lost her.
Oh, for heaven's sake.
All right, I'm going to try and figure out how to use this phone.
Well, we're going to try to call her back. Okay. So what I will do, okay, because this is an interesting case that just, a gal's calling in for her sister who apparently can't call for herself. So looking at hip pain. So had one that was really very, very cool. Okay, so that was entrapment of the saphenous nerve at Hunter's Canal. But the more typical one, hip pain, that'll cause knee pain as well. Easy problem to fix. Easy problem to get, but a really tough one necessarily. Oh, okay. All right, there's a muscle that wraps from underneath the knee that attaches in the anterior portion of the hip. The muscle that you would use to walk up and down stairs, to walk forward really, to cross your legs in particular. And what it will do is it will become inflamed if you step in a hole or if you kick an object or move a heavy object by using your foot as if it were a shuffleboard stick. You push things along and then boom, you start having a hard time walking. The pain in the knee can become intense, and frequently you'll have pain in the back. And it'll feel to some degree like a kidney stone. It may feel as though somebody were kicking you in the back. Misdiagnosis of herniated disc happens all the time.
And it's not.
It is not.
I think we've got it repaired. Jen, checking in from Beachside. Are you there?
Yes, I am.
Oh, good. Let's hang on just a second. Let me finish this one up, and then we're going to pick her up. And so what these things were. So we had 2 of these this week, and it was a tendinitis of a muscle called a Sartorius, just north of the knee. So what will happen is it will hurt across the anterior portion of the knee, the lateral portion up by the hip, and right on that little bone that gets injured when you play football. Having difficulty walking up and down stairs or crossing your legs is pathognomonic. You fix it with transdermal ketoprofen or transdermal diclofenac, something called Voltaren.
Yeah.
But you have to put it in the right spot. You put it on, you wait 60 seconds, the pain goes away. It's kind of cool. These things are surgical disasters if you operate on it. Hopefully we didn't lose her again. Okay, now I've closed that out. Let's move on to the next one.
All right, Jen, I know you're calling for your sister. Give us an idea what's going on, though.
Okay, well, she's 26. She's been having symptoms for about 10 years, but it's gotten worse in the past couple years,
All right.
with it being at its peak in the last couple months. She's having fatigue, muscle weakness and aches, stabbing pain, spasms in the arms and legs, trouble seeing, headaches, seeing colors, trouble eating, and her symptoms tend to be worse in the afternoon and night
Okay.
and after activity. the doctors thought that it was MS. And then she had some blood tests and MRI done of her head down to the base of her spine.
Sure.
They didn't find any lesions, so they said it wasn't MS. So now they're saying it's fibromyalgia.
Okay.
Lorazepam, 0.5 milligrams 2 times a day, which she can't take because, 1, it doesn't do anything, and 2, it just makes her sleep. She's taking baclofen.
Baclofen, sure.
Well, she's prescribed it, let me say.
All right.
0.5 milligrams. It doesn't do anything. And then she was prescribed B12 as well because she was a little low in that. And she has been tested for her TSH values.
Yeah.
And in January, it was 1.58. And in March, it was 1.85.
Okay, it's the same number.
That's the only thyroid test she's had, and all other autoimmune tests that she's had were negative.
Okay, yeah. So she hasn't been worked up particularly well. Okay, and again, looking at the thyroid is a smart way to do it. You can have autoimmune thyroid disease where the TSH is going to be normal. You can be profoundly hypothyroid because, again, from the nature of the disease, and have symmetric pain like that because of the entrapment of the nerves in the wrists, ankles, the knees, elbows. It's very, very interesting how that can happen. So at the very least, she needs to be worked up a lot better with regards to the thyroid. Are there other things that can happen that can cause the thyroid to go south? The answer is yes. If she has too little estradiol on board. But at the age of 26, that's unlikely, but it costs $20 to rule that out. So you do it. But I'm starting to think I'm sorry? Estradiol. Yeah, you don't need to get estriol, estrone as well as estradiol. Just the estradiol is sufficient. And the value should be between 50 and 80 or a little bit higher, because if you don't have enough estradiol, TSH doesn't get secreted. So it can be a false way of developing a picture that is hypothyroid but doesn't measure that way. So if you don't have the capability of secreting TSH, the levels will be normal, but you're not. But there are a couple other things I'd be putting in there just to look at autoimmune factors that are not necessarily looked at. They'll look at CRP, maybe. But interleukin-6 would be something that I would have right away. But what I'm believing the case is going to be, and this is going to sound a little bit weird, but does she have, or did she have gastrointestinal problems that preceded the headaches and the other miseries?
Yes.
Okay. All right. Okay. And when she had these these miseries in the gut, there may not have been any headache at all, correct?
When you had gut issues, was there any headache? No.
No. Okay. There's something called acephalgic migraine that can do this. Okay, or migraine without headache, and it can give you all of the symptoms that you just mentioned, actually. And the way you can figure this out, it's a simple thing to do that'll cost you about nothing to find out. The medication is called Ajovy. Now, Ajovy is called a calcitonin G-related peptide blocker, or CGRP. And if your doctor, your family doc, your neurologist, I'm sure you have a neurologist by this point, okay, doesn't have these things in samples nearby, I'd be shocked. Because what they do is they bring you in there, warm the sample up a little bit because it's kept in the refrigerator, and pop you the Ajovy, and then wait about, I don't know, a day or two and see if the pain starts to improve. And it's dramatic. A CGRP blocker, and the reason I choose Ajovy in your age group is that if this thing started while you were a teenager, acephalgic migraine seems to be what does this. And the gastrointestinal profile with regards to Ajovy is better than the others. So they may have Aimovig, not interested. They may have Emgality, not interested. It's got to be Ajovy. And then see what happens. Give it at least a week maybe before you really go back to the doc. And if that looks like you're heading in the right direction, it's a life changer. Now, why would I pick that? Okay, because I have a lot of experience with it, as it turns out, on a family level as well as on a professional level. So what you were describing to some extent was very similar to what my wife has. So she had these abdominal migraines since she was a kid. She lost lots and lots of time at school for what they thought was an irritable stomach. Oh, her stomach was a misery. She couldn't this and she couldn't that. She was a good student, but she couldn't get up off the bathroom floor without vomiting. And so what we did, I started dating her, And, being a doctor is not always the easiest thing to do when you're dating. Okay. I got to tell you, it's kind of hard to, it's very hard to be objective. Not that difficult sometimes, but sometimes it is. So this, a Jovi was a trick that we did on my wife, and it knocked her migraines out. And she had headaches. Sometimes all she did was get nauseated. Now, there's a couple confusing things about my wife, okay, that are definitely somewhat different from what you've got going on. But short of that, okay, I would give that a try first, because if that's what it is, it's easy and it's not that big a deal to intervene on this. The neurologist should be all over it. Right. Now, with regards to fibromyalgia, that's a joke.
Yeah, fibromyalgia is a catch-all.
It's a joke. It means they couldn't figure it out.
They can't figure it out, so they're like, yep. It's like a trash can answer.
So give that a whack and let me know how you go, because if that's the case, it'll change your life, as it changed mine. My wife was having 25 knockdown, drag out, puke on the floor, headaches per month. She's now down to, I have a minor headache once or twice a month, maybe.
Okay. And remember, Jen, and anyone else who needs that information, you can always get the podcast or go back and watch the videos for all of this information, because I do realize it's a lot to jot down, to digest all at once. I talk fast. Well, you talk fast and you use big words, and sometimes even I'm like, what? So I'm just saying.
Well, you have to use big words, because if you don't, you can't charge anything.
Well, yeah, but you have to know what those big words mean. That's how you get the big dollars. Anyway, so we have some knee questions, orthoscopic surgery questions as well, which all go into cryptogenic pain.
Cryptogenic pain. Let's figure out what's wrong when it's no longer cryptogenic. Now, is it?
There you go. All right. It all makes sense in some twisted way. We're going to take a break for a couple of minutes here, and then we'll be right back. You're listening to Stages of Life Radio on News Radio WFLA Orlando with Dr. David Klein. I am Melissa Fox. Thanks for hanging out with us. We'll be right back.
I would hate for her. I mean, I'd love for it to happen. Okay, for somebody to go on like that for 10 years, and just be bouncing all over the damn place for a migraine.
Right. Well, most.
And she's in the right age group.
Oh yeah. No, when you were saying and all that, it was the same with me. I had the gut thing to test throughout my young life. I had to take medicine. It didn't really work.
Yeah. It's all in your head now.
And then I had the headaches, and then and they were like, "No, there's nothing wrong with you," and vomiting and the whole thing. Couldn't sleep, couldn't eat. Everything she's just said.
Right.
At that whole time frame too, and and they were having me on Advil, like an Advil regime every day. I'm like, no, I don't need this.
Well, then the Ativan, lorazepam, okay, which is an anterograde amnestic. It just makes you stupid. Yeah. And tired. And you've already got somebody who can't sleep.
And tired, yeah. Thanks.
So let's make you sicker. Lorazepam it's like when I was in training, and through the first 25 years of my practice, I spent a lot of time with neurologists in my building. And if you didn't walk out with lorazepam, you didn't see the doc. That stuff is nasty. So I'm glad she wasn't taking it.
Yeah, it's kind of cool that she wasn't taking it.
Yeah, actually. Good for her. Yeah.
I mean, I'm not recommending that people don't take their medication, but sometimes when it just doesn't make sense, for God's sakes, get a second opinion.
Yeah, well, you have fibromyalgia, so I'm going to give you lorazepam. The number one cause of fibromyalgia is hypothyroidism. So the listener had that figured out. She goes, they checked her TSH. What you don't know is that that's only one of about 15 things you have to check to really know whether it's thyroid or not.
Indeed, but that's part of it. And the other part is it leads, with thyroid messed up, can lead to a pseudo-anorexia, which is what was also going on. Happened to me. It's like I was shoveling it in, potatoes and gravy and meatloaf.
And then you wear it well.
Yeah, and nothing was happening.
It's kind of like the old spaghetti. See if it sticks against the wall? So do the potatoes.
Right. Oh, we got a quick text I want to answer here.
All right.
Welcome back to Stages of Life Radio. Hey, if you have a Lyme tested for Lyme disease.
That's Borrelia is the name of the bug. Go on.
Right, and you're below 91, should you be concerned?
What, an age below 91?
No, the Lyme test.
Oh, okay. It depends on which you're looking at, titer, antibody, or what. There's a lot of things that could have been checked. What happens with infectious disease? Okay, so you get exposed to a bug. Now, it could be something like COVID. Now, that's something happening a lot. So people have exposure to COVID. You got your inoculation. So we're going to go ahead and we're going to check your antibody levels. They degrade with time. Shingles degrades with time. Pneumonia degrades with time. So does Borrelia. So what will happen is that everybody that gets exposed to Borrelia, and there are multiple Borrelia bugs, your titers go up. Now, let's say that you continually get exposed to it. The titers can remain up. So you'll see this in people that live in country areas or people that are continually being exposed. Doesn't mean you got sick. So just because you have a titer to one thing or the other doesn't necessarily mean you're ill. So let's say you have a high COVID titer, as I do, and as my wife does. And you probably do.
Probably.
Why? Okay, because you got the shot. That doesn't mean you have the disease, does it? Mm-mm. You have the antibody. That doesn't mean you have the disease. So just because you have the antibody for Borrelia doesn't mean jack.
May I also say that in my mind, somewhere Lyme disease falls in the fibromyalgia department?
No, it's real.
I know it's real, but a lot of times it's a catch-all phrase when they can't figure out what's really going on.
Well, it gets back to what we were talking about earlier about causality. So there are doctors all over this country that earn a living doing nothing but pandering to people, telling them that they have Lyme disease, and then treating them with thousands of dollars worth of medications, IV this and IV that. Mm-hmm. And, well, the titer does not have to drop. It doesn't have to this. And, just because you've got the test doesn't mean you have it. Just because you don't doesn't mean you don't. But everybody has Lyme disease until proven otherwise.
That was kind of, Dr. Klein, that was kind of exactly my point, is it's like if we can't figure out really what it is, we can call it Lyme disease, or we can call it fibromyalgia.
One of my patients, okay, his son, okay, so I got along with the patient, the patient didn't, the husband, okay, of the kid, the husband of the wife, child, husband brings the kid in, son. And this kid's 24 years old, so an engineering student. He had done very, very well. He goes out west camping. Okay, and then one day he gets sick, and then his IQ gets knocked off about 40 points, and he's having absence, seizures, and all kinds of crazy stuff. Would I be willing to see him? Now, this kid was told all kinds of stuff. Well, it could be this, could be that, and must be Lyme disease. It must be this. It must be that. Okay, now understand this. There are lots of reasons why people can develop infections and get sick. There are many organisms out there that can make you ill. So this one didn't at all sound like Lyme disease to me, but it did to a bunch of people with substantial backing behind them with regards to fancy names and institutions. So I agreed to see the guy. So I went ahead and looked at him, and he just really didn't feel right. He had neck and shoulder pain. He had headaches. He had nausea, all kinds of stuff. But it was very, very abrupt onset, and then it stayed. And so with a little bit of tweaking, it turns out that he had something called leptospirosis. Okay, now leptospira is also one of these bizarre cell wall deficient organisms. And I treated the kid with, I think, 21 days of doxycycline, and he got better. And I told him, I said, I don't know if that's going to be sufficient. We're going to go ahead and wait and see. And he did okay for about a year, and then it came back another 21 days, and that took care of it.
Wow.
So these things do happen. Rickettsial diseases. Now, Colorado, Rocky Mountain, but also places like Maryland, Ohio, Pennsylvania, New York, rickettsial diseases can happen. And they're equally devastating. They're equally difficult to test for. And the treatment, oddly enough, is very, very similar. But if you go to the old-fashioned doxycycline and then see what the heck happens, if the symptoms improve, man, you are right on the way to get this thing done. But the diagnosis is not as simple as, gee, you must have Lyme disease, which is probably one of the most minor of all, like the actors.
Again, yeah. We got Bob on the line. Hey, Bob. Bob, turn down your radio and listen to your phone, Bob.
All right.
There we go.
There he is. All right, you're on with the doctor.
He's back.
What's going on with this back pain you got here, huh?
Well, I've heard good things about turmeric for lower back pain.
Good.
And especially somebody I know has scoliosis, and he's having trouble with his back too. Is that credible information about the turmeric?
Yeah, it's fine, except that the better thing to figure out is what is causing your backache. So you might have a urinary tract infection. You could have prostate infection. You could have a knee problem. You could have all manners of things that'll cause backache, to include, tendinitis at the hip. So you really need to find out what's going on. Now, if the problem is inflammatory, then turmeric is a brilliant choice. What's in there is a curcuminoid that hits tumor necrotic factor alpha. It's an antagonist to this thing. And so it's a type of anti-inflammatory that's not unlike things like Motrin, Naproxen, except it works chemically very, very differently and doesn't have any kidney drag to it. There's no damage to it. So it's good stuff. What you need to know about turmeric is they're not all the same. And just because you see one on television doesn't make it the best. So there are 6 or 7 different curcuminoids that are really worth getting into. So you have to make sure you get a good one. Okay, that doesn't necessarily mean the ones that are advertised, because they're not any better than the rest of them. Well, ours is better absorbed. Really? Nonsense. Tell you what, you go ahead and you take just regular curcumin and see if your poop turns yellow. It doesn't. So it's nonsense. It gets absorbed just fine. So don't pay attention to this is better absorbed or that, because there's no clinical backing and there's no research to really support those claims. So is it worth doing? The answer is yes.
Is black pepper a good one?
Okay, you don't need to add pepper to it. Pepper, what it'll do is it's pepperine is what you're looking to add to it. If it were me, okay, I would just simply take the turmeric, which is cheap, really, really inexpensive, and then start working the dosage upward with it. More so, okay? But when you add pepper to it, all you're doing is making a product that's harder for you as a consumer to make on your own. So we keep turmeric in the office. We don't add pepper to it. Why? Because if you want to add pepper, you can add a little salt and a little sugar if you choose to. A little ketchup might work. Butter, hey, just anything but margarine, and then make it work. But there's something I want you to try.
No, but it's
that
didn't mean add pepper.
Oh, I know. I'm just being me.
We're just messing with you, Bob.
I'm messing with you. But there's something I'd like you to try. Okay, and it's a proteolytic enzyme called bromelain. Now, bromelain you take on an empty stomach. You put the bottle at bedside. You take 2 or 3 of them in the middle of the night and see if you wake up pain-free. If you do, then the diagnosis is very, very different. But it's a proteolytic enzyme. The stuff is marvelous. Bromelain.
Love it. Again, you don't just treat the back pain. Find out what the heck the problem is.
You got to.
And even with the scoliosis, of which I have,
everybody has scoliosis
to a certain degree, of course. Nobody has a perfectly straight back. You'd look stupid.
Yeah.
I mean, all reality, it's muscles, short muscles that are pulling things in different ways.
You have joints that are asymptomatic. Your face is not symmetric. Why should your back be?
Right. So there can be some inflammation there. There can be something that can be done. Exercises, etc. You got to keep yourself limber and loose anyway.
Yeah.
With the back problem. Very quickly, Linda said she treats her knee problems because she has problems bending with the weight and has already had being told she needs knee replacement. Just uses ice pain pills like acetaminophen or ibuprofen and or a brace. First issue would be lose weight.
Lose weight's number 1. And then turmeric is nice. You can use the bromelain. That's better than the topical Kinkies, believe it or not.
Right,
You rub it behind the
that.
knees. It's cheap, it's easy, and it'll work within 20, 30 minutes, and you got it.
Stages of Life vitamins. You can find Kinkies and a lot of the other stuff that Dr. Dave's talked about. We'll be back again next Sunday at 4 o'clock. Dr. Dave, say goodnight.
Good night. It is good to be here in sunny Florida.
You've been listening to Stages of Life Radio with Dr. David Klein. Check out stagesoflifemedicalinstitute.com or stop by 1917 Booth Circle in Longwood near the intersection of I-4 and 434. Call 407-679-3337. That's 407-679-3337. Dr. Klein accepts most insurance and Medicare too. Join us next Sunday at 4 p.m. on News Radio WFLA Orlando.
This hour, we're having a salute to a recording artist who says that his biggest source of inspiration was the airwaves, Stevie Wonder.
My greatest influence was radio. It was my greatest friend in that I was able to go many places just sitting in my living room. And even more than sitting there and going there, I could imagine them to be any way that I wanted to see them as being. And that's somewhat the disadvantage sometimes of television, because it doesn't leave anything to the imagination. It's just, there it is.